Good morning. I'm Tom Garrett from CBIA, and I'd like to welcome you to our 2014 Medicare Advantage Group Awareness Training Webinar for Brokers. I'd like to thank ConnectiCare for sponsoring today's event, and also a big thanks to our presenters, David Pallotta, Medicare Group Specialist, and Matt Gallagher, who's Director of Medicare Sales, both at ConnectiCare. Today's webinar, which should last about 30 minutes, is mandatory for anyone who plans on selling CBIA's Medicare Advantage plan, and it is a CMS requirement. So, in terms of the way the webinar is going to work, at any point during the webinar, feel free to submit your questions to our speakers by typing them in the Q&A box on the lower right of your screen. Make sure it's the Q&A box and not the chat box in the middle. So hopefully take a look at the lower right quadrant of your screen. You see the Q&A box. You just click in the box, the lower box, put in your question there, and hit send. And after the slide presentation, I will get these questions over to David and Matt. Also wanted to make you aware that a recording of this webinar and the Q&A will be available later this week at CBIA.com in case you want to share them with anybody else from your office. So I guess without further ado, I'd like to now turn it over to Matt and David. David?
Thank you very much, Tom. Appreciate it. Thank you all brokers for attending this. This is the 2014 Medicare Advantage Group Awareness Training. And what this will allow you to do is be able to sell the group product through the CBIA platform. It does not allow you to sell our individual product unless you've gone through that separate training. So I just want to make that aware for everyone. What we're going to be touching on today is that we will be working through the CBIA Medicare Advantage Group plan itself, the enrollment, member services, important reminders, and then we'll touch base on the Q&A as well. Hopefully everyone has had a chance to review the brain chart that was sent out earlier, which is the full presentation touching base on all parts of Medicare, A, B, the more basics of what Medicare are, and then this is going to be more specific to the plan itself as well as some of those other topics on the agenda that I mentioned. As we look forward here, the highlights to the plan, it is a comprehensive plan. It does include both a medical plan as well as a prescription drug, so it's referred to as an MAPD, and the price point is actually still staying where it was last year at $339.93. There has been a few improvements that we will touch base on to that. It is available to all CBIA employer groups. It's available to retirees based on the guidelines of what CBIA has set forth for retirees, as well as employees that are actively working. So these would be 65 and over or Medicare eligible individuals that are actively working within groups that are under 20 employees. It is a Medicare Advantage. It's a point-of-service plan. And so the design of the plan is mirrored for both in and out of network. And what this means is that you do not need to reside in Connecticut. You can reside anywhere in the country, and the benefits will be the exact same for someone that's here in Connecticut as it would be for anywhere else. There is a maximum out-of-pocket, which we refer to in the industry as MOOP, and it's a financial protection. It's $3,400 again this year, and that's a combination of co-pays and co-insurance that add up, that an individual will not pay any more than that $3,400 in the course of a year. After the $3,400, it would be covered in full. Keep in mind that the prescription drug coverage co-pays do not apply toward that max out-of-pocket. You do have worldwide and urgent care coverage, and that's up to a $50,000 annual amount. There is a commission, obviously, that's attached to this product, and it's on both the medical and the prescription piece. So it's of that $339.93, you get 3% commission built in, and the initial effective date of this is for January 1, obviously. If you do have groups that are renewing throughout the year, the price would be good for the year of 2014. And again, we maintain our very high rating for healthy plan quality in the state. We do not have the final CMS stamp of approval, but we do anticipate having 4 out of the 5 stars rated by CMS for our plan. As we move further into the plan highlights, as I had mentioned, it is an MAPD, the PD or prescription drug portion of that. This is a Part D plan. So the prescription drug portion of this is a Part D plan, and it will have a preferred and non-preferred network. This is something new for 2014. Approximately right now, 50% of our utilization throughout our entire Medicare Advantage product currently uses our preferred network. So I think you'll find in the paperwork that I believe Donna has pushed out a preferred network listing. You can also access that via our website at ConnectiCare.com/Medicare. Again, it is a national provider network for our pharmacy. There's about 60,000 pharmacies across the country. It is an open access to our medical plan. There's no referrals that are required. Some services do require prior authorization, something certainly no different than the Advantage plan over a supplemental plan or traditional Medicare, is that Medicare Advantage plans are very proactive when it comes to preventive health. So we provide a full comprehensive annual physical. The Medicare allowed is what's referred to as an annual wellness exam. This wellness exam is really nothing more than a visit to the doctor and some simple vitals that they check, but it does not go into a comprehensive annual physical such as what we do. Another improvement that we've added to the plan this year is Silver Sneakers, and this is a fitness program where it allows the individual to have a basic membership at facilities that are there, accessible through the silversneakers.com website, and you can put in your zip code and come up with a listing of those. It also allows you to access that across the country. So if you were someone that obviously lived outside of the area or were traveling, you would be able to access that network. Another point with our prescription drug plan, in addition to it being a national network, it does also have an open formulary. And this is something a little bit different than we have on our individual products, and is certainly something that is an open formulary currently in 2013, so it's going to remain that way for 2014. We do also provide vision discounts as well as routine vision exams and hearing exams, and these are two things that Medicare does not cover, nor does the supplemental plan generally does not pick those up, but as our preventive services, we do include that to being a routine, which is coverage under the specialist copay. And then we also have our touch points. Our touch points is a program that we have that revolves around case management. So when someone has COPD or diabetes or heart disease, cancer, they get involved or can get involved with a team within our organization that helps make sure that they are getting the appropriate care and that they are following up with required recommendations from their doctors to make sure that they are managing those diseases in an appropriate manner. They also help with treatment decision supports and reminders for immunizations, for wellness exams, for medications, all things that we do to help those seniors make sure that they're getting access to and most appropriately taking that care that they need.
That's great, Dave. I just would like to remind the attendees also that all this information is on CBIA's website, including the preferred RX listing.
Thank you, Tom. As we look at the plan itself, again, we touched points on the premium already, the maximum out-of-pocket. As we said, the preventive service is the physical exam, and all preventive services are covered at no cost. The primary care office visit is a $15 copay, and the specialist visit is a $30 copay. Again, as I mentioned about the routine hearing and vision exams, things that are not covered by Medicare are covered by ConnectiCare, and those are covered at a $30 copay. Your lab services, diagnostic radiology, therapeutic radiology are all a zero copay. Ambulance, as well as your emergency coverage, are all zero copays. And your outpatient surgery is done on two different platforms. If it's done in a hospital setting, then it would be a $300 copay for that outpatient surgery. If it's done in an ambulatory surgical center, it would be a $200 copay. Under the prescription plan, and this is where you see a slight change from the current plan design to next year, and it's because of the the preferred and non-preferred pharmacies. So what we've done is we've actually kept the same copay structure that was in place today, which is 10, 40, 80, 80 for those tiers 1 through 4, and we kept that on the non-preferred side. So it's actually an improvement as we go to this year with the preferred and non-preferred. As those individuals utilize our preferred pharmacy network, they're going to save an additional $5 per tier. So it's really an improvement over where we were last year. The network for our plan, the medical plan here in Connecticut, which does also touch base on some of our bordering states, is over 27,000 fully credentialed healthcare providers. We have every hospital in the state except for the Children's Hospital in Hartford. We do have a slightly different network from the ConnectiCare commercial. So you need to be careful as you're talking to people that are transitioning maybe from the commercial product over to our Medicare product to just make sure that people that they're accessing are still available on the Medicare directory. The point of service plan does offer, a great flexibility because you're able to see doctors both in and out of the network at that same copay structure. And the way this works is that you want to make sure that as that individual goes to see a doctor that does not participate with ConnectiCare, that at least that they accept Medicare fee schedules or accept Medicare assignment. And what this means is that that doctor is saying that, yes, I will understand what Medicare is going to pay for this specific procedure, and that I will accept that payment in full. That doctor would then send us a claim, not to Medicare, but they send the claim directly to us because as someone enters into our medical plan, which is a Medicare Advantage prescription drug plan, we're taking over for Medicare in the processing of those claims for that individual. Yes, they still need to be in both Parts A and B, but to us. And because this is a nationally filed product, if that doctor so choose, we could actually contract with them if that was something that they desired as well. So you've got a lot of access there. And then, as I mentioned, we do have Westerly Hospital, some New York providers, and some Massachusetts providers in our bordering states here to Connecticut. As I mentioned, the pharmacy is a national network at about 60,000 pharmacies strong, and the preferred pharmacy network does include Rite Aid, Walmart, Target, Costco, Stop and Shop, as well as many others. The two big ones that you will not see on there would be Walgreens and CVS. And these are contractual. CVS, being owned by CVS Caremark, would not be something that would contract with us at a preferred rate. And if you all recall, last year we were able to keep Walgreens in our network, where in a lot of the others with Express Scripts, they were not, so we were able to make that happen. But again, they did not want to do the preferred pricing with us. Keep in mind, though, that both of those pharmacies and all their locations are accessible on our non-preferred pharmacy, so they can still be accessed, and it's just a difference of a $5 copay. Now, our plan itself, with the prescriptions, recall, just as it is this year, that we have full coverage through the gap. So anyone that's asking you about donut hole coverage, sometimes it's referred to, you're going to maintain those copays right through your what's referred to as the initial coverage limit, which is the beginning portion of the plan, and then anyone that spends over $2,850 will then transition into what's referred to as the coverage gap or the donut hole. And again, with our plan, you're just going to continue to pay those copays until you reach the catastrophic phase, which would be $4,550 of costs. And at that point, then it goes to either a copay of $2.55 for a generic, $6.35 for a brand name, or 5%, whichever number is greater. Our provider directory, not only for the medical, but as well as for the prescription, is available at ConnectiCare.com/Medicare is the quicker way, but you can certainly access that through ConnectiCare.com as well. With regard to enrollment, prior to the enrollment, the broker should provide the following. We have a pre-enrollment letter, an enrollment form specific to CBIA for ConnectiCare, as well as a benefit summary, which is things that were certainly accessed, as Tom had mentioned, being available on the CBIA website. If you need paper applications for some reason, we can certainly assist with the supplying of those. If anyone wants to have a hard copy of the formulary or the provider directory, we certainly suggest online because it's the most up-to-date and most accurate, but if anyone does want to have paper copies, we can certainly supply them with those items.
David, seeing we're about halfway through your slides and
yeah,
you did have some late attendees, I did want to remind folks to type their questions into the Q&A block in the lower right of your screen, and then at the conclusion of the webinar, David and Matt will answer your questions. So you can get them to us at any time. Don't wait till the end, and we'll make sure that everybody's questions get addressed.
Thank you, Tom. As we then have all the paperwork submitted into CBIA, the individuals will receive the following, which would be an ID card, an evidence of coverage, which is the comprehensive explanation of the benefits themselves and exactly how the plan operates, benefit of summary, which is a smaller, more condensed version. They'll get a provider directory. There is an opt-out. Now, keep in mind, this is, if anyone was picked up a directory at the CBIA meeting last week, realizes how thick that is and certainly costly to mail. So if you do need that, that's there. If the individuals don't want to receive a copy of it, especially if you've got a husband and a wife that are joining the plan, they certainly don't need two of those directories. On the application itself, there's a kind of opt-out, go green, and only provide one directory, or again, to really direct them online is almost even a better direction. And then they will receive also a copy of the formulary. The enrollment eligible applicants must complete the enrollment forms. Okay, the applicant submits directly to the broker or the employer, and then the broker then submits to CBIA. CBIA will then send us a feed, which will allow us to get them entered into the system. and they must sign the application. The absolute latest date for a January 1 effective date is December 31st. Keep in mind, this date differs from what a lot of publicity is about the annual election period, which is for individuals making choices for their Medicare product this year. The AEP, or the annual election period, runs from October 15th to December 7th. So because this is a group product, it works a little differently in regard to the timing. The standard open enrollment period for CBIA is November 1st through December 15th. So ideally, in order for an individual to get an ID card and those items that we had, in order for them to have all of the necessary paperwork and ID cards for January 1. If they were to submit it and send it in on December 31st, obviously we would need time to get that turned around to them. So this is just for their sake. Communications after the enrollment, there's a number of steps here that involve ourselves as well as a couple of people, companies that we've partnered up with. But the acknowledgement letter, receipt of the enrollment application is the initial letter that they're going to get. This is a letter of intent, essentially. Then they will get a notice of confirmation from CMS. So once we get the paperwork in, we then send it off to CMS to verify that the individual has both Parts A and B, and then that's when they would then receive the notice once we get confirmation from CMS that they are good to go. Again, they'll get the member ID, which is both for your medical and prescription, which is on the same card. They'll also, within the welcome kit, which is a separate mailing from the ID card, have some information regarding our organization, our touch points. The Silver Sneakers will have some information in there about that as well. Then there's a number of phone calls, and this is a great opportunity for you to be able to address these with the individual and let them know that they're going to be receiving a couple of phone calls. There's some things that we do that help us to establish if there's additional needs, medical needs for people, and that's done with our Healthy Risk Assessment call. This is not something that is required by the individual to participate in, but it's certainly something that's encouraged. And what this ultimately will help us do is to make sure that we're able to report back to CMS any comorbidities that a individual might have, any disease. And by doing this, it helps us to be able to have that individual priced correctly, and that we're getting the right money that we should to help care for that individual on a monthly basis. So the health risk assessment is a really important call. If it goes beyond that and the individual has some deeper needs, we can actually do an in-home health assessment. And this is where a registered nurse or a nurse practitioner actually comes to the home and goes through medications with the individual, visits, kind of interviews the individual in getting a better idea about their health needs and assessment. They then actually report back to their primary care physician their findings so that they do communicate with them, and that information goes nowhere else but between ConnectiCare and the primary care physician and obviously the individual themselves. Then we have a member outreach program, and this is with Optum. This is for some assistance that will help them be able to manage some additional items that take place there. I'm trying to exactly figure out what that is. The premium payment assistance call, this is where they're calling to see if an individual may qualify for what is referred to as extra help. If they meet a certain financial requirements that exist there, they may qualify to get their Part B premiums paid for. may qualify for some other programs that are offered within the state program. Our member services is available from 8 to 8, 7 days a week, and they are available to assist any member that may call in with questions, looking up doctors. I need a new ID card. It really runs, anything that they might need. They may be looking for a specific lab or assistance in finding a specialist. They are able there to help out with those items. And the number is 800-224-2273. There's also assistance if anyone has difficulty with hearing and needs additional TTY or TTD call-ins.
Okay, I wanted to just let the attendees know also we seem to be having some issues with the Q&A. However, you can type your questions in the chat block, and I will get those to David. What you want to do there is just type them in the section entitled chat and send them to presenter or all panelists, and we'll make sure we get those questions.
Thanks, Tom. We ended to the important reminders. Something that came up before we touched base on these bullet points, I wanted to bring to everyone's attention is something that is an additional premium. It's referred to as IRMA, and IRMA stands for our product, but the Anthem product as well. And what this is it's a higher wage earner income. So it's an extra premium that is assessed by the government. It is not assessed by ConnectiCare. It is not assessed by Anthem, but it may require an individual that is earning an income over $85,000 as an individual or over $170,000 as a couple that is filing jointly, that they pay extra premium for their Part B. With our plan, it also will affect their Part D because our plan is a Medicare Advantage prescription drug. That prescription drug portion of our plan is a Part D plan. So if they are paying extra for their Part B premium, they're going to also pay extra for their Part D premium. And I sent over Donna a full description of what those are. It's actually a document that's put out by the Social Security, and certainly that's something that could be pushed out if need be. And if anyone has any further questions regarding that, I would certainly be able to answer those questions. As we look at the kind of follow through with here, this plan, as I said, we've maintained the price point and made it a little bit better. And again, broker commissions are 3% of the full premium of that amount. Again, we rank 4 out of 5 stars, and that's certainly a very big achievement. It's certainly something that it makes up. The star rating is a customer service, customer report type of program that's put out by the government, and it ranks companies against each other, and there's about 50 some odd categories that make up a star rating, that everything from how happy people are from the plan from the previous year to the designs themselves to appeals and grievances to how we handle our prior authorizations to our pharmacy program. So it really makes up quite a bit, and it's not any one little thing that can cause a plan to go down. So by reaching the 4-star, it certainly keeps us at the very top of Connecticut, and it's certainly a proud achievement for us. So the comprehensive medical prescription coverage is one that allows an individual to be able to see doctors across the country, as we said. You have the same type of program both in and out of network in terms of copays. And you've got the flexible to use the Medicare-approved providers throughout the United States, and that's the most important thing to remember is that when someone does see someone outside of the network, that they are making sure that that individual does accept Medicare fee schedules. He's got coverage across the world for both emergencies and urgent care. And you've got a fairly low price point of security, of liability that that individual is exposed to, which is referred to as the MOOP of $3,400. We've added the Silver Sneakers program into this. Certainly something that has been very well received by our seniors. And you get discounts on vision for frames and lenses. And again, the quality disease management programs that we have, the care management programs to our touch point, really help to round off our entire plan. The next steps would be, as we had mentioned, through the CBIA.com/Medicare. All of these items are available, the enrollment form, the summary of benefits, links to our website where you can then access our providers for both the medical as well as the prescription. The formulary is there. The 2014 should be posted in the next week or two. We're just waiting on final approval of that from our parent company, and that should be posted shortly. The claims reimbursement form for both the medical as well as the pharmacy are all available again on the CBIA Medicare website. Mailings to all the current CBIA Medicare supplement members, mailing to the employer groups, and then by all means contact your CBIA sales representative if there's any information that's missing, any questions you might have. They would certainly be able to get in touch with me if it was something that they were not familiar with, and we'll get that answer as quickly as possible back to you. And that pretty much does it for the presentation here. We can move on to Q&A. I know, Tom, you were having a little difficulty with the Q&A portion. I didn't see any questions come up, so I don't know if you've seen any come through the chat.
I did have one question, yes, come through the chat, and that was, David, can you summarize the basic differences between an individual ConnectiCare MAPD plan and the CBIA group MAPD?
Yeah, we've done a pretty extensive effort into making sure that there are differences between the two, because we wanted to make the CBIA product unique. So, first and foremost is the prescription drug side. We do not offer a plan on our individual product platform that is without that coverage gap. All of our plans on our individual side do have a coverage gap, so there's a difference when an individual hits the donut hole in terms of how their coverage is paid. It's also a different copay structure. The CBIA plan is a 4-tier structure, and all of our plans within our individual product are moving to a 5-tier structure. The formulary itself is open versus being closed on our individual products. So those are probably the biggest points within our formulas. We do have some plans that are out there that offer copays. You do have, obviously, the coverage is the same, especially under the lab portion. All of our, so when you're looking at the lab, the diagnostics, the therapeutic, the ambulance, the emergency coverage, all of those things are copay plans when you're looking at any of our other individual products. And so those are all zeroed out on the CBIA plan.
Great.
And those are the highlights, yeah.
Yeah. Next question, and I would remind folks to submit their questions in the chat area. Next question is, what is the Part D monthly upcharge for those earning more than $85,000/$170,000?
There's a range, and I can certainly, Tom, I had sent Donna that document, which I think was still for 2013, off of the Social Security FSA.gov website. for IRMA. And I quickly looked for the 2014 numbers, and for the Part B side, B as in boy, it looks like there's going to be an additional charge of about $230. So that would be on top of whatever the standard is going to be. The standard in 2013 is $104.90. So if you're at that 85 and under, your standard Part D cost is $104.90. And then there could be the additional charge above and beyond. Medicare has not come out with the 2014 numbers yet. They're always a little slow in getting those out. But it's in the neighborhood of about $230 additional dollars that someone would make. And that's if they were earning over $428,000 as a couple. And I think it's over $230,000 as an individual. And then on the Part D side, it follows along in that same scale. It could be as high as $69.30. So if someone was earning in the $428,000 plus range filing jointly, they would be looking at close to an additional $300. And now again, these are fees that are going directly to the government. It is a higher wage earner. It's not something that comes to ConnectiCare. It's not something that goes to Anthem.
Great. Also, just to add why questions may be coming in, one of the other questions we do get a lot is if we have a current CBIA member who's on the ConnectiCare Medicare Advantage plan and they are renewing into this plan, do they need to do anything? And the answer to that is no. They will automatically renew into the plan for 2014. And they'll get all the appropriate documentation. There's nothing new or additional forms that they need to fill out. Great. Well, that appears to be all the questions we have, so I wanted to give a big round of thanks to David for the fine job he did on his presentation. If any of the attendees have questions in the future, you can feel free to get in touch with your CBIA sales team. I'd like to also thank the attendees for joining us and the questions they've given us. I hope you found the program to be informative and helpful, and wanted to say thanks and have a great day to all who attended.
Thank you very much, Tom. Thank you all. Appreciate it. Good luck.